If you've been struggling with severe acne and nothing seems to work, you've probably heard of Accutane, but wondered, is it really worth it? What are the actual pros and cons? My name is Dr. Brooke Jeffy, and I am a board-certified dermatologist in Arizona. And today we are getting into whether Accutane is worth trying. First, let's talk about what Accutane actually is. Accutane is the original brand name for a medication called isotretinoin. It is a powerful oral retinoid, which means it's related to vitamin A. It was approved by the FDA in 1982 for severe nodular acne that has not responded to other treatments. Today, it is also commonly prescribed for moderate to severe acne that causes scarring or significant emotional distress, even if it's not classic cystic acne. So how does it work? Isotretinoin attacks acne from multiple angles. It shrinks the oil glands in your skin, dramatically reduces oil production, lowers the levels of acne-causing bacteria, reduces inflammation, and prevents clogged pores. No other acne medication targets all of these pathways at once. That's what makes it so uniquely effective. First, I want to explain the pros of Accutane, and then I will tell you the downsides to taking Accutane. Biggest advantage is that isotretinoin is the only acne treatment that can actually put your acne into long-term remission. In clinical studies, about 70 to 80% of patients see a 90% or greater reduction in their acne after just one course of treatment, which typically takes about 5 months or so. Roughly 40% of patients stay completely clear after a single course. Another 40% may see some acne return, but it's usually milder and responds to treatments that didn't work before. Only about 20% need a second round. Beyond clearing your skin, quality of life improvements can be dramatic. Research shows that patients experience significant improvements in emotional well-being, sometimes within the first 2 months of treatment. For many people, the psychological burden of severe acne, including anxiety, low self-esteem, and social withdrawal, improves substantially during treatment. Another pro is that Accutane can help prevent permanent scarring. In my practice, one of the most important reasons to consider isotretinoin early is to stop scarring before it becomes irreversible. Many acne experts agree that if your acne is causing scars, isotretinoin should be strongly considered regardless of how many other treatments you have had. Now, let's talk about the cons because there are real ones to be aware of. The most common side effects are dryness related. Nearly all patients will experience dry, chapped lips. About 70% get dry skin, and around 30% notice dry eyes. Joint and muscle aches occur in roughly 1 in 4 patients. The good news is that all of these side effects are dose dependent and they go away once you stop the medication. There are also some lab changes to watch for. Triglycerides and cholesterol levels can go up during treatment. About 44% of patients see some rise in triglycerides, and about 31% see a bump in cholesterol. Liver enzymes can also increase in about 11% of patients. These changes are usually mild and temporary, but your doctor will monitor your blood work throughout treatment. One of the most talked about concerns is whether isotretinoin causes depression. And this is understandable, especially since many patients taking it are teenagers and young adults, a group already at higher risk for mood changes. Here's what the research actually shows. Large population-based studies have not found a significant increase in depression or suicide among patients taking isotretinoin. In fact, one large study of over 440,000 patients found that suicide rates were actually lower in isotretinoin users compared to the general population. That said, mood changes have been reported in some individuals. And since retinoids can cross into the brain, it's still important to monitor how you're feeling throughout treatment. If you notice any changes in your mood, tell your doctor right away. Another common myth is that isotretinoin causes inflammatory bowel disease. Multiple studies and meta-analyses have looked at this carefully and have not found a meaningful connection. Prior antibiotic use for acne may actually be the confounding factor behind some of those earlier reports. The most serious risk of isotretinoin is that it causes severe birth defects. It is absolutely contraindicated during pregnancy. In the United States, all patients, both male and female, must be enrolled in a monitoring program called iPledge. Patients who can become pregnant are required to use 2 forms of contraception and have monthly pregnancy tests throughout treatment. This is non-negotiable. So is isotretinoin worth it? For many patients with severe or treatment-resistant acne, especially when scarring or significant emotional distress is involved, the answer is often yes. It remains the most effective acne treatment available and the only one capable of producing lasting remission. But it's not a decision to take lightly. It requires commitment to monthly doctor visits, blood work, and for those who can become pregnant, strict pregnancy prevention. The key takeaway is this: isotretinoin is a powerful medication with real benefits and real risks. Whether it is right for you depends on your specific situation, your medical history, and a thorough conversation with your dermatologist. If your acne is affecting your confidence, causing scars, or just not responding to other treatments, it's absolutely worth having that conversation. If you found this helpful, make sure to like and subscribe. Drop a comment below if you have questions about isotretinoin or other acne treatments. And as always, talk to your doctor before making any changes to your treatment plan.